Because if we think about it, bodies are toothpicks with rubber bands. And so if the toothpicks are your bones, then the rubber bands are your muscles and soft tissue. The joints can be doing joint things, but because the rubber bands are too tight, then it's affecting joint function. So I want to see, okay, how does that motion happen? Where are the points where she goes, I don't want to do that? Or what does the body feel like underneath my hand? Does the muscle brace up and go, yeah, I'm not going to let you do that? And if that's the case, is that because we have a nerve that's pinching? Is it because there's too much muscle tension? Girl.
A lot to feel and a lot to think and visualize.
Yes. Girl. Yeah, thank you. I'll do that side in a minute too.
So if it's possible to articulate, describe if you're picking up on there being a nerve problem, how that would be different.
Yeah, okay. So nerve problems tend to be a lot more insistent. So muscle tension just goes, yeah, the tension you feel or the restriction in the motion is going to be like, no thanks. I don't think so. Like, that's tight. That hurts. Like, if you ask me to touch my toes, I'll be like, yeah, But then if it's a nerve problem or nerve impingement causing that, they'll be like, yeah, no. They'll be far more insistent on that. Because with a tight muscle, we can sweet talk it and get it to do the thing. But with a pinched nerve, that's like not happening. Yeah, exactly. Ready? I like to give them that moment to process as we go through, even though it means the treatment ends up taking that much longer. They do a better job of integrating it into their life. If every time something feels better, I go, hey, think about that for a second. And they shake it off and they yawn and they lick and they chew and they go, oh, I can move my neck. And then we go on to the next spot. It also keeps them it keeps them a lot more willing to let me work through them when I give them that moment to just decompress. Proprioception? Nociception? Yeah, I think that's the pain. Yeah, proprioception is your relationship with space. Okay, yeah, let me know. I'm all for big words. I know. So she's very willing to do the bending, but you see how she's like, let me do it in this kind of twisty, let me do it my way, which is not a very graceful way. So that's her desire to please and her training going, oh, you want to bend? I'll give you a bend, which a lot of our good horses have that. They're like, yeah, I'll do that for you. But if you look at them or if you feel it when you ride them, you're like, you're doing it, but it doesn't feel like, or it doesn't look like it should. And you're not sure why. Come here for a second. Hi. Good girl. So, especially in her neck, she has that where she's very willing to please, but her body has restrictions that she's working around. So I try to isolate those there so that we can softly bend and not have to contort and be grumpy about it. Good girl. It's a good one, huh? Yeah. Good girl. So right now, her C4-5 joint is kind of moving, but not really moving. And she's very protective of the musculature around it. And so she's, yeah. She's going, let me give you that bend in my other joints. And maybe you won't notice that that one is only doing 20% of its job. And that's something that is very easy for them to get away with because of how their necks work and how their bodies work. All right. Okay. So I'll give her a second, and then we'll run through it again just to help the rest of that area reset to the point that that joint movement is not protected like it was. Hi. Girl.
I mean, I'm going without house, but I didn't want to assume.
Good girl. Yeah. Ready? Good girl. You step off the wall a little bit. Good girl. And I'm just sliding in to check the brachial plexus, which is the nerve bundle that resides there underneath the scapula. And with shoulder tension, neck tension, work in general, that can become compressed by that shoulder blade. It sucks down, so those nerves get compressed between the shoulder blade and the rib cage. And that doesn't make anybody happy. Good girl. Yeah. Good job. Yeah. Good girl. Good kid. If you have any questions, just holler. Yeah, yell it out. If you're wondering exactly what I'm doing, then
I'm curious how often you work on faith on her schedule.
depends a little bit on our schedule. We've been doing like once a month, unless there's a problem that pops up. That's more normally Jules that does something silly in the pasture.
So
It
does faith have anything like medically or
absolutely.
she has.
Yeah.
Wendy.
So I guess my question is, so, I was reading after you invited me, I don't know. But about that, to talk to your vet before you do this.
Yeah.
That they agree with it and all that shit was good.
Uh-huh.
But so did you do that with Faith before you went into this?
I mean, I've been talking with Wendy about this
Oh,
for
yeah.
a long
Wendy, yeah.
time. Yeah,
And Wendy's, yeah.
yeah, yeah. So, no, I mean, she's still, Faith had injections this year, and
Okay, that's,
when we have lameness issues, and Bethany and I ride like twice a week
Yeah.
often. So if I'm feeling something or she's seeing something, you know, yeah, she can get off and check things out and see how things are going.
yes.
But there's oftentimes it's like, yeah, you need to go see the vet. Yeah,
Mhm.
there's something up here that is not just a little pinched nerve or
Right.
Yeah.
muscle or something like that. So
Okay. Yeah, and that's what, yeah, like I said, I was reading and and Wendy, of course, is my vet. That's, yeah, that's interesting because I have a horse.
Mhm.
Well, with the game, but, so I was just, and Wendy, you know, I was just wondering, since you have already had a relationship with Wendy, have you too?
Yeah, I know Wendy.
Okay,
Oh, yeah.
yeah.
Uh-huh.
So that, yeah, that's what I was wondering. So
Yeah.
Wendy's on board with
Yeah.
what you're doing.
yeah,
Cool.
yeah, it's kind of like, I mean, I remember way back in the day before you were doing stuff too, and I wanted to get chiropractic work and stuff like that too. Just before moving to Bend, I had been through a lot of different things, chiropractic wise, acupuncture, massage work for my horses. So getting up here, you know, trying to find people that did all that as well. I think in the beginning, even chiropractors said, I need a recommendation from your vet before I can work.
Mhm.
So I don't know if what you do actually requires it or.
It's kind of a gray area, you know, depending on how the law is interpreted. I tend to keep good relationships with vets. You guys are always welcome and encouraged to fill your vet in and be like, hey, do you mind if we do this?
And that's what I was saying, since you have like Wendy working on
Mhm.
here now, she's got a plan and all that kind of stuff.
Right.
To say, look at, I'm thinking about
Uh-huh. Yeah.
what do you
Definitely, if you're under active treatment for something, definitely I want your vet on board. If it's like, hey, this is my horse that I ride and we see the vet every 2 years and whatever,
Yeah.
I'm less concerned about, you know, having your vet on board. But if you're actively treating condition, injury, rehab, whatever, then yeah, I want to be on board with your vet. Because it can be very supportive. So like with what the vets are going to do, they're going to do your injections, they're going to do your laser, your shockwave, those treatment side of things that are specific to your injured place, tissue, joint, whatever it is. Then what I would do would be more supportive, going, let's unwind the compensation puzzle. Because if I limp on my right ankle, it's going to start showing, you know, left hip, my back, you know, all that stuff. And so the vet's going to come in, treat that right ankle.
But then you're gonna the other stuff that's going on.
Yes.
That's because of that injury.
Yes. Yep. And it just helps them get better effect from your vet treatment.
Yep.
So we're releasing the tension, holding them in that pattern of compensation. It will prolong how well it does. It makes them happier because instead of having 6 places that hurt, I can remove 5 of them, ideally, and we have the one that your vet is treating, and they're like, I feel amazing because I only have one painful spot. Yeah. So there's a lot of good working with vets. Hi.